Good morning, my dear students. Today I like to discuss one of the most important 5-star hot topics. This is called nephrotic syndrome. You never missing it. You never ignore this topic. Remember this. It is very important. Very important for both undergraduate and also post graduation. Remember this one. First of all, you have to know what the definition. What the definition of the nephrotic syndrome? To look your book. Nephrotic syndrome may be defined as massive proteinuria, hypoalbuminemia, hypercholesteremia, generalized edema. Now what are the types? It's classified only two classification. One is idiopathic nephrotic syndrome is 90%, rest 20% is due to membranous nephropathy and membranoproliferative glomerulonephritis, and also lymphoma, leukemia, hepatitis B virus, hepatitis C virus, hepatitis HIV virus, and malarial parasite infection. Remember this one. Now how the patient present to you. How the patient present to you. First you know the age of the patient. Age is 2 to 6 years. The most important time is 2 to 6 years. Male female ratio, male is more dominant than the female. Remember this one. After this, then edema is fitting edema. Fitting edema which started from the face and periorbital region, then generalized and a sarcasm. Remember this one. Next, there is the anorexia, abdominal pain. Look to your book. Abdominal pain, diarrhea, prone to infection, cellulitis, sepsis, spontaneous bacterial peritonitis, UTI, pneumonia. These are all of the infection. Now the diagnosis. How to diagnose this? Very much important. How to diagnose the disease? First of all, you have to go for urine analysis. Urine microscopic examination. See there is a plenty of fast cell and hyaline cast, and there is heat coagulation test. This is called deep stick test. Deep stick test or heat coagulation test, 3 plus 4 plus 5 plus, like this. Then a spot urine sample, 14 to creatinine ratio is more than 2. Next, to go for 24 hours URD 14 is more than 1 gram per square meter of body surface area per day. Remember this one. Next, go for serum cholesterol. Serum cholesterol is more than 250 milligram per dl, and serum albumin will be reduced is less than 2.5 gram per dl, and there is also albumin globulin. There is the albumin globulin ratio will be reversed. Remember, these are all the diagnostic purpose. Next, some investigation should be done for sepsis screening. This is complete blood count with or CRP and exercise PBO. Then acidic fluid is analysis. Then anti-nuclear antibody, malarial parasite, BDRL, HBCIG. This is for sepsis screening. Remember this one. Now you should go how the management, what the management plan. What is the management plan of the nephrotic syndrome? First of all, you say the supportive management, then specific management, then treatment of the complication, then counseling and follow-up of the patient. This is the headline. Remember this one. Remember this. First, supportive treatment, then specific treatment, then treatment of the complication, then follow-up and counseling. This is the headline of the treatment. Remember this one. Now, supportive management. Supportive management means immediate hospitalization. Then balanced diet. The protein and calories. Protein and calories diet should be given, and maintain the renal chart. Maintain the renal chart. Remember this one. For edema, potassium sparing diuretic should be given. Remember this one. Then for infection, you given one antibiotic for 7 to 10 days for control the antibiotic. After supportive treatment, then you go for specific treatment. The treatment of choice is prednisolone. Remember this. Prednisolone is the drug of choice. Remember this. It is given how? It is given two types. One is initial attack, another one is relapse cases. Initial attack, we given the prednisolone 60 milligram per square meter body surface area per day, 3 divided dose, 3 divided over 4 to 6 weeks. Then after 4 to 6 weeks, that again it is tapering the dose. Then tapering the dose 40 milligram per square meter of body surface area. A single morning dose every alternate day for another 4 to 6 weeks. This is the initial attack. But what is the relapse case? For relapse case, you should given the 60 milligram per square meter of surface area every morning single dose until unless protein free for 3 consecutive days. Until unless urinary protein free for 3 consecutive days. Then you tapering the dose 40 milligram per square meter of body surface area morning single dose every alternate day for another 4 to 6 weeks. This is the specific treatment. Then treatment of the complication. I told you treatment of the complication. That's infection. Infection, if infection, you will be the broad spectrum infection. What are the infection occur here? Number 1 infection is spontaneous bacterial peritonitis, sepsis, cellulitis, UTI, and pneumonia. These all of the infection. You are given the broad spectrum antibiotic. Next complication is arterial venous thrombosis. Arterial venous thrombosis, then more low molecular warfare should be given. Next, you given the other complication. This other complication is what? Others complication the cardiovascular complication. Then hypovolemic shock. These are all of the complication. Now what is the prognosis? Minimal change. The prognosis of the disease. Minimal change nephrotic syndrome prognosis is very good. It's so responsive. Nephrotic syndrome is relapse and remission is character. That is relapse and remission. And finally resolve the disease spontaneously at the age of 2nd decade. It will be improving spontaneously. Now the counseling. For the counseling bit, for the counseling, parents counseling about the natural history of the disease.